every time I turn on television, I see an ad telling me that I need to contact my legislators and tell them to not cut Medicare, that the Democrats are planning a huge savage cut to Medicare Advantage. And I wonder if you could get into that a little bit. I mean, Medicare Advantage is that part of Medicare that's administered through private plans, and it's become quite popular. And this whole question about what constitutes a cut and how these plans are paid and why it's become such an enormous political issue, I wonder if you could get into that a little bit.
Yeah, let me do one kind of preliminary thing to set this debate up, that even in the CBO baseline that we just had, I'm sure your listeners know by now that spending is going to go up over the 10 years, and it's worse now in this CBO baseline than it was in the last CBO baseline. But actually, Medicare spending over the next 10 years is projected to go down. And that's primarily because of the Inflation Reduction Act's reduction in prescription drug spending. This prescription drug spending reduction means that seniors will pay less for prescription drugs, their premiums are going to go down, and their cost sharing is going to go down. Now, that reduction in Medicare spending has been targeted as a Medicare cut, but I don't think it's what a normal voter or a normal senior would consider a cut. It means they're going to be actually spending less on their healthcare, and the government is going to be spending less on healthcare because prescription drug costs are going to go down. So this Medicare Advantage kerfuffle is very similar, that there are many ways to reduce Medicare Advantage spending that actually make the overall Medicare program better off, that can reduce premiums and cost sharing. And so it's really important that we don't get confused when we can lower federal spending and it's not necessarily a benefit cut. So let me take the Medicare Advantage thing specifically, because we've done a lot of work at the Health Savers Initiative on reducing Medicare Advantage spending. This is one of our main things we look to when we want to increase trust fund solvency, because if you reduce spending in Medicare Advantage, you can help improve the solvency numbers for Medicare overall. As you said, it's this private insurance system within the Medicare program. Over the last 20 years, it's grown really dramatically, where from about 15% of Medicare beneficiaries enrolled in the program to now over half of all Medicare beneficiaries get this private insurance from Medicare. And it was originally designed to see whether private insurance companies can administer Medicare benefits more cheaply than traditional fee-for-service Medicare, either by competition among the insurance companies or by using insurance company tools like narrow networks of doctors or prior authorization or other benefit management, if they could do that less expensively than the government. So that sets up what I consider to be one of the great budget travesties of the last 10 years, because we actually found that these private companies can provide benefits more cheaply to Medicare beneficiaries. And they can do so while feeding some of those savings back into better benefits for dental insurance, vision insurance, hearing insurance, lower premiums, lower out-of-pocket costs for beneficiaries. And we found out that that is one tool you can use to reduce healthcare spending. The big problem is that the federal government has not shared in any of those savings. They've been plowed back into better benefits and into higher insurance company profits, to where now the government spends more to insure someone through Medicare Advantage than it does to insure someone through traditional Medicare. And this is a big problem. We consider these payments to Medicare Advantage plans overpayments because these insurance plans have figured out how to game the system, get more payments from the federal government, so that the federal government does not share in their savings. It's instead going to extra benefits and higher profits.